How do you determine a patient's PAH risk status?
As I mentioned earlier, risk status is really been kind of the buzzed term over the last decade in PAH. It initially sort of came to the forefront in our guidelines back in about 2015, where we started to recognize that some of the tests that we got indicated better prognosis for patients, and when we put those different factors together could really assess how somebody would do on a longer term basis. So, to determine the risk status of our patient, we actually have different calculators. These days, we have quite a number of them. Some of them utilize, upwards of over 10 different tests and results of those tests and how patients feel and things like that that we impute into a calculator, and that helps to then give us kind of the risk status. But now, knowing that we're not asking our patients to do a right heart catheterization every time we see them, or even an echo every time we see them, we've recognized that there are other ways that we can assess risk status. Some of those are really in very non-invasive ways, which include like someone's heart rate and someone's blood pressure, someone's kidney function. And so those go into how we assess that. Each provider may do it slightly differently, meaning that they may use a different calculator, but those calculators all have shown consistency across our populations. So we feel pretty confident that as long as that we're using one of those calculators to assess someone's risk status, that we would all be able to come up with the same status for that individual patient.